We're now live on Facebook. You can go ahead.
Great, thank you for joining us today. I'm Matt Brown, Sonoma County Communications Specialist, and this is our COVID-19 update for Wednesday, October 27th. Let's begin with a brief message from Gilbert Martinez from our communications team for our Spanish-speaking viewers. Gilbert?
Buenas noches y bienvenidos a la sesión informativa. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Ahora regresamos para atrás con Matt Brown.
Great, thank you, Gilbert. We have a lot to cover today, so I'm going to turn it over to Dr. Sundari Mace, our health officer, for an update.
Thank you so much, Matt, and good afternoon, everyone. The big news this week is that yesterday, the Food and Drug Administration's Advisory Committee recommended the Pfizer vaccine for 5 to 11-year-olds. This is the key first step in the process to make this age group eligible to be vaccinated. If the FDA agrees with the committee's recommendation and authorizes the vaccine for this age group, the decision will then go to the Centers for Disease Control and Prevention, which will meet November 2nd and 3rd. If the CDC also approves, we could roll out the vaccine for 5 to 11-year-olds as soon as next week. Here in Sonoma County, that would mean another 37,000 kids would be eligible to get vaccinated and enjoy the same protection from COVID-19 as nearly 80% of our residents 12 and older. We are busy preparing our pediatric vaccination rollout plan, and we're working closely with the Sonoma County Office of Education on a series of school-based vaccine clinics. Like everything we have done during the pandemic, our pediatric vaccine campaign is being planned with a focus on equity. The target sites for school-based vaccine clinics are in areas with recent high case rates, areas with a high number of English learners, and areas with lower vaccination rates. Our health equity team is also seeking additional engagement and input from community advocates who represent these communities. We'll talk more about our pediatric vaccination campaign today, but first, I would like to provide an overview of where we stand in the pandemic. Our case rate continues to decline. We are now averaging 7 new cases per day per 100,000 residents, and our testing positivity rate is less than 2%. Looking at our case rate another way, we are at 35 new cases per week per 100,000 residents. The weekly case rate is a key metric because it's what CDC uses to assign color-coded tiers to the counties. According to CDC, Sonoma County is currently in the yellow tier. If we can keep our case rate below 50 per week, which is required for the yellow tier, we would meet one of the 3 benchmarks needed in order to lift our indoor mask mandate. A stable hospitalization rate is the second metric, and the third metric can be achieved in one of 2 ways. Either we wait 8 weeks after the vaccine is approved for 5 to 11-year-olds, which would leave the mask mandate in place through the end of the year, at least, or we fully vaccinated 80% of our total population, age 0 and up. We are currently at 69% of our total population fully vaccinated. But starting to vaccinate our younger children, 5 to 11, potentially as soon as next week, should significantly increase our vaccination rate. More good news to report is that hospitalizations continue to decrease. There are currently 22 people in Sonoma County hospitals with COVID, which includes 7 in the ICU. This is a sign that our vaccination campaign is working to prevent the worst outcomes of the virus. In regards to our mask mandate, last week I issued an amendment to the health order that allows for certain stable cohorts of fully vaccinated individuals to go without the mask indoors. Essentially, this means that people can remove their masks at gyms, offices, college classrooms, in religious services, and other places where they regularly gather, if everyone can show proof that they've been vaccinated. This applies to groups of not more than 100 individuals, and businesses still have the option of requiring everyone to wear face coverings indoors. And people still have the option of wearing a mask if they feel that they are more protected by doing so. Finally, with Halloween coming up on Sunday, I want to take one last opportunity to remind everyone to enjoy the festivities but take precautions to do so safely. Trick-or-treaters should avoid large groups and wear a mask that covers their mouth and nose. Before eating any treats, people should wash their hands or disinfect with sanitizer. Indoor gatherings of unvaccinated people, including children, should be avoided. If you're sick or concerned that you've been exposed to COVID, stay home. People greeting trick-or-treaters at the doorstep should wear masks while distributing candy. Instead of inviting children to reach into a communal candy bowl, consider handing out individually wrapped treats or placing them on the table. Do not distribute candy if you're sick or have been exposed to the COVID virus. I know that a lot of people are looking forward to enjoying the holidays that we missed last year, but we still need to do so safely with the virus still circulating in the community. So for more on our vaccination campaign, I'm going to turn this over to Dr. Urmila Shende, our vaccination chief.
Thank you, Dr. Mace. The question on everyone's mind this week is, when will the 5 to 11-year-olds become eligible to be vaccinated? As Dr. Mace mentioned, an FDA advisory panel yesterday took the first step in that process, recommending the Pfizer vaccine for that age group. The CDC must also approve the pediatric vaccine, and they're scheduled to meet November 2nd and 3rd. So if everything goes as planned and everything lines up and the safety data is reviewed once again, we could have an approved vaccine by the end of next week. Sonoma County has already requested an allotment of pediatric vaccines, so we could be ready to start vaccinating children the week of November 8th. In preparation for the rollout of the pediatric vaccine, the County Department of Health Services has been working with local health and education leaders on plans to provide free vaccines to children as soon as they are authorized. Families will first be encouraged to seek vaccinations from their local pediatrician or healthcare provider. Vaccination clinics will be created at schools to serve people without convenient or affordable access to healthcare providers, targeting areas with high rates of COVID-19, low vaccination rates, and neighborhoods with large numbers of English language learners. By December 1, we hope to vaccinate a quarter of the 37,000 children in Sonoma County aged 5 to 11. The campaign will seek to vaccinate half these children by the end of January and 70% by the end of February. We're working on an outreach campaign with the Sonoma County Office of Education, which will include webinars designed to provide more information and answer questions parents may have about the pediatric vaccine. Please check the County of Sonoma Facebook page for more information about these webinars coming as early as next week. We'll take some of your questions today, but first I'd like to hand it over to Kate Pack, our lead epidemiologist, to present some important data. Kate?
Okay, thank you, Dr. Shende. I'm going to share my screen. Okay, so since we're talking about pediatric vaccines today, I wanted to share some data specific to this population. When we look over the course of the entire pandemic, we can see that 5 to 17-year-olds have accounted for 15% of the over 40,000 COVID-19 infections that we've had in our county. So that's a little over 6,000 cases. Looking just over the past 60 days, we can see that this age group actually accounts for the majority of the cases that we're seeing in our county, with over 20%. Looking at pediatric hospitalizations, we can see that over the course of the pandemic, 13 children between the ages of 0 and 17 have been hospitalized with COVID-19 hospitalizations, and 6 additional children have been hospitalized with MIS-C, and that stands for multi-system inflammatory syndrome. And this is a serious COVID-19 related condition where different parts of the body can become inflamed, including the heart, lungs, kidney, brain, skin, eyes, or gastrointestinal organs. Fortunately, all of these pediatric patients were discharged from the hospital. When we look at the 12 to 17-year-old age group who is currently vaccine eligible, we see that 63.5% of this population is currently fully vaccinated, with another 7% partially vaccinated. Looking just since the start of the 2021-2022 school year, you can see here in the orange that the COVID-19 case rate among unvaccinated students between the ages of 12 to 17 have been much higher than those of fully vaccinated students. And this chart is displaying a rolling 14-day average daily case rate. And you can see here the peak that we experienced in the county as a whole that also was seen among this age group. If we look at all infections that have occurred since the start of the school year and compare unvaccinated students with those who are fully vaccinated, we see that unvaccinated 12 to 17-year-olds have been infected with COVID-19 at a rate that's 20 times higher than that of vaccinated 12 to 17-year-olds. And we do have a page on our COVID-19 cases dashboard now that is dedicated to transitional kindergartens through 12th grade COVID-19 cases among students and staff. And I'm going to share some snapshots from that data. So you can see since the start of this school year, there have been 686 COVID-19 cases, with the majority of those cases occurring among students. Of those cases, 67 of the cases were confirmed to have occurred due to on-campus transmission, so exposure to a positive COVID-19 case on campus while school was in session. This chart is showing the trends in the numbers of student and staff COVID-19 cases by week. Again, you can see this August surge that we saw countywide. More recently, we've seen fewer cases among students and staff per week. This chart is taking into account the population size among different grades of students. So when we look at just transitional kindergarten through 8th grade, that's this gold line here. When we look at the weekly rate of student cases per 100,000, you can see that the TK through 8 students have had more cases than have high school students, shown here in the blue. And it's worth noting that in the TK through 8 age group, the majority of these students have not been vaccine eligible until the recent decision came out. This dark line here is just representing the overall case rate that we've seen since school reopening per 100,000. Looking at student cases by geography, we can see a disproportionate number of cases occurring in the lowest quartile of the Healthy Places Index. And what this refers to are the areas of the county where residents have the least access to resources to support their health and well-being. And this chart is based on the home address of students with COVID-19 infections rather than the address of the schools. But we can see that a third of the cases that we've seen so far this year have been in the lowest quartile. Looking by geography, we've seen the majority of cases in the central region of the county, followed by the North County and South County. We will be updating our geography tracking on the dashboard to include case rates by different regions of the county to take into account the greater population in certain areas of the county versus others. Looking at student cases by race and ethnicity, this column is showing what the population distribution looks like in general among 5 to 17-year-olds in Sonoma County. And then this is the proportion of cases by race, ethnicity. And so you can see when we look here at Hispanic, Latino, or Latinx students, this demographic accounts for 44% of children aged 5 to 17 in Sonoma County, but 49% of the cases. So we can see a disproportionate number of cases in the Latinx community with the cases tracked so far in this school year. We also see a slightly higher proportion among Black African-American students, 1.7% of the population versus 1.9% of cases. So we know that children between 5 and 11 and 5 to 17 are also part of households. And throughout the pandemic, household transmission, shown here in this light brown color, this is over all time, 30 to 44 days ago, in active cases. We can see where we know what the source of transmission is, that household transmission has been the most common source of transmission throughout the pandemic. So COVID-19 infections in children may place older and more medically vulnerable household members at risk, and particularly if these household members are unvaccinated. When we look at our death data from May to present, and the reason that time period is selected is by May, the majority of the population had access to vaccine. When we look at deaths from May to present, and we adjust for age, you can see that local unvaccinated individuals are over 32 times more likely to die from COVID-19 than are vaccinated individuals. And when we look by specific age groups, you can see that the death rates for unvaccinated individuals range from 29 to 70 times higher than those of vaccinated individuals. When we look at the deaths by race and ethnicity, and here particularly for Latinx versus white non-Hispanic deaths, we can see that there's some similarities. So when we look by gender, in both of these groups, a disproportionate number of males were among the deaths that occurred. When we look at underlying conditions, the majority of both groups, about 9 out of 10 of these individuals had underlying conditions. And in both groups, the majority of the deaths were unvaccinated, about 7 out of 10. But a difference that's apparent is among the Latinx deaths, the deaths were younger. They were occurring in younger age groups, and you can see here with the dark gray bar. And when we look at the disproportionate impact on the Latinx community, looking at 2020 data, we looked at life expectancy. So that would be how long you would expect an infant born today to live. When we compare the data for 2020 compared to the prior 3-year average, we see that life expectancy in 2020 decreased 2.1 years for Latinx residents, but less than 1 year, 0.7 years for white non-Hispanic residents. The premature death rate, or years of potential life lost from COVID-19, was almost 10 times higher for Latinx residents as compared to white non-Hispanic residents. And in 2020, COVID-19 was responsible for 7% of all premature lives lost for Latinx residents compared to 1% for white non-Hispanic residents. And looking overall at the deaths that occurred, COVID-19 contributed to 12% of total deaths for Latinx residents as compared to 3% for white non-Hispanic residents. So these findings really highlight the disproportionate impact that COVID-19 has had on the Latinx community in Sonoma County, and also highlights why it's important that the outreach strategy for vaccine factors in equity and reaching the most impacted communities. That is the end of my slides, so I'll turn it back to you, Matt.
Great. Thank you so much for sharing all that important information for our COVID-19 update for Wednesday, October 27th. We'll now take some questions from the community and our media partners. And Dr. Shende, let's just looking at the questions from the community, we're having a lot of questions about the pediatric vaccine, obviously. And the main question most parents have is about safety. There seems to be a perception that children are not having the bad outcomes from COVID, even though, as we just heard from our epidemiologist, children have had 15% of all cases, and within the last 60 days, 21% of all cases of COVID. So they are certainly contracting it. Can you talk about the safety of the vaccine versus the health risks of actually getting COVID, and your advice to parents?
Absolutely. So of course, we're waiting for all the data, but the data that was presented to the FDA shows that the vaccine is very safe in this population. 2,200, more than 2,200 children were studied, and the side effects were similar to that for adults: sore arm, a fever, some fatigue. And in fact, the side effect profile seemed to be less than what happens in adults, probably related to the fact that the dose is a third of what is given to adults or those over the age of 12. So the side effect profile looks very good. In general, we know that the vaccine has been around now for more than 10 months, and we have seen that the overall safety, or the side effect and the safety profile is very, very good for this vaccine. So that helps us quite a bit. In addition, we know that more studies are continuing, and there are 2,300 children who are continuing to be studied, and that data will continue to be observed as time goes on. So safety, I feel, has been evaluated. I think it's a very safe, a very effective vaccine. The antibody levels, which show what one's immune response will be with this vaccine, is very, very good, and shows that it should be effective against preventing COVID. I think it's very important to keep in mind that, in addition to what you mentioned, Matt, that the rates over the past 60 days have been significant in the pediatric population, is also the fact that children can be a source of transmission. We see this every year with other viruses in the wintertime: RSV, flu, the common cold. So we know that COVID is going to be present in our community, and it's going to be transmitted, and particularly because the segment of the population that is not protected right now are those who are largely under the age of 12. They are going to be a reservoir of infection. And so to try and protect the rest of the community, it's going to be important to protect our youngest members. And this is one of the big reasons to consider the vaccine. In addition, we know that even though overall children are not as ill with COVID as older people, we do see some severe outcomes. As Kate mentioned, cases of multi-inflammatory syndrome in children have occurred, and we have had cases within Sonoma County. Also, there have been many hospitalizations, and that potential is always there. So overall, I think when you look at the risk-benefit ratio, I think the vaccine will impart significant improvement and protection against COVID and help our community. And just on a personal note and a professional note, I've practiced pediatrics for more than 20 years in Sonoma County. And one thing my patients have always known is that I would never recommend a vaccine that I wouldn't recommend for my own children or my own family. And I would strongly recommend this vaccine, and have given that advice to my nieces, my nephews. My kids have already been vaccinated, and they're not children anymore. So I do feel that this is going to be quite beneficial for everyone.
Great, I appreciate that, Dr. Shende, and thank you for that advice. Another question, interesting question. You mentioned that the pediatric vaccine is 1/3 of the dose of an 12 and older dosage. that seems to be what they found to be providing enough immunity. But what if someone has like an 11-year-old or someone that's at 11 and a half years old? Should they wait 6 more months to get the adult version of the vaccine, or should they get it now? And then once they turn 12 years old, will they need a full adult dosage at that point?
Yeah, good question. I would say, just as we said with the beginning of the vaccine rollout, as soon as one can get vaccinated, one should. The data, again, is very, very strong in terms of antibody responses, even in those who are at that upper age limit of the 5 to 11-year-olds. So I would recommend getting it right away. Another question I've received recently is, what about those who are 5 years old, but on the smaller end of the spectrum in terms of their weight? Should they get the vaccine, or should they wait? It still would be recommended that in that age group, regardless of what one's particular age, whether they're closer to 12 or whether their size or weight is less, the vaccines have been found safe based on those ages. So it would be recommended if one's child is in that category.
Great, thank you. Another question about supply. We know that the pediatric vaccine comes in different vials. It's using different needles. Are you confident that Sonoma County will have the supply of pediatric vaccines needed to meet the demand?
Yeah, great questions. Can you hear me now? Yeah. So for the first 1 to 2 weeks, the supply is going to be a bit limited, only because the federal government and then CDPH, the state, are slowly rolling out the shipments of these vaccines. So for the first couple of weeks, it's a bit limited, but then after that, we've been guaranteed that the supply is going to pick up. So it should not be an issue. It's going to be nothing like it was in the beginning of the vaccine rollout back in December, January, and February. What we have been told is that within 2 to 3 weeks, supply should be significantly increased. And as you mentioned, it's a different vaccine. It has a different different way that it is reconstituted. Hence, it's completely different. So one is not going to be using the adult version and just modifying it to give to children. It's a completely different vaccine, and it comes with its different supplies, syringes, et cetera, to ensure that the right dose is given.
And I would just remember that it's a much smaller target population at this time. So as Dr. Shende said, after the first couple of weeks, I think we shouldn't have any problem with supply.
One other thing to mention is that we're of course encouraging people to go to their primary care provider's office and receive it there if they can. Pharmacies will also have the vaccine, and we will have school-based clinics, but we really would like to have those clinics available for children in that school district or at that particular location, because these sites have been picked to help address the inequities that we have seen in our population, in our community due to COVID. As Kate presented, we see that there have been significant effects in marginalized communities, and to try and encourage and have available that vaccine for those populations is going to be important. So please keep in mind that there are many other sources for receiving the vaccine, and so it's going to be important to be able to get the vaccine at different locations. There are many options.
Great. Thank you so much. Shifting gears a little bit, Dr. Mace, there's a question about testing in schools. As we know that there was a high school football game that was recently canceled due to COVID impacts. A question Sumaya asks, why are vaccinated students still required to get tested for sports?
Yeah, that's a really great question. Even vaccinated individuals can get COVID and transmit COVID. And we have to remember that anybody who's symptomatic, anybody who's been exposed needs to be tested for COVID to make sure that we're not having further transmission in the community.
Great, I appreciate that. Let's take a question from our one of our media partners, Martin Espinoza. You want to ask your question? Go ahead.
Hey there, can you hear me okay?
Yes, thank you.
Dr. Shende, I wanted to take you back to what you referred to as risk-benefit ratio. When we, and some of this data that you guys have just released on pediatric hospitalizations is interesting. 13 children from 0 to 17 have been hospitalized, and this is since the beginning of the pandemic, I imagine. And is this 6 number, is that of the 13, or is that an additional?
That's additional, Martin.
That's additional, okay. And so those are small numbers, but they are numbers. I mean, they're real people, they're real kids. Based on that 2,200 number that you were talking about, that Pfizer took a look at when they evaluated the sort of the side effects or the impacts, how do you balance out this, you know, that benefit ratio that you're speaking of? Did we see more kids? I mean, are we seeing more kids here in Sonoma County impacted by COVID than we would see having side effects from the vaccine?
Well, I think that it's multifactorial. There is the extreme effect of COVID, as you mentioned, that of hospitalization and of this condition called MIS-C, multi-inflammatory syndrome of children. We certainly want to prevent those worst outcomes from happening. In addition, we know, again, that children are a reservoir and they can transmit the infection. And if we hope to get COVID to become like the common cold eventually, then we really do need to protect as much of our population as possible. Now, if there were significant concerns of side effects from the vaccine, then that would be a concern. But at this point, the vaccine appears to be very safe and very effective. And in being able to protect that segment of our population, that's going to get us closer as a community to coming back to normalcy and to being able to control COVID. So I would factor in a number of these issues in terms of deciding. And then, as I mentioned, transmission. So also making sure that within a household, within a family, that the eldest members of the family are protected. Protecting the children is going to be one way of protecting those who may not mount as much of an immune response. So there are many factors involved. And I think when one looks at the pros and the cons, I think the vaccine is going to be beneficial in many ways.
The reason I ask as a follow-up is that you do have a lot of people, a lot of parents looking at the reporting site, and they're looking at numbers of people that have come down with side effects and adverse reactions, but it seems like sometimes we're not looking at some of this other information that you just put up about pediatric hospitalizations. Those are real numbers. What's worse for what we're seeing in the hospital?
Could you repeat that? It cut out a little bit. I didn't hear the full sentence.
What is going to be worse, the side effects that parents are afraid of, or the actual pediatric hospitalizations that we're seeing?
I see. Yeah, overall, the side effects are quite minimal for children. So the chance of having severe outcomes such as hospitalization or inflammatory conditions, that the side effects are very minimal compared to those severe outcomes. So I would want parents, I would think it's important for parents to take all that into consideration.
Thank you.
Yeah, the hospitalizations that have occurred have been few, but significant enough. And that's the worry, that COVID-19 does impact children as well. I think that's kind of what we need to get out. It's, you know, we have low numbers, but children have been hospitalized. The side effects from the vaccine are generally the very minimal side effects that all of us have after taking any vaccine, a fever, maybe headache, that kind of thing. So I think we're looking at two different things there.
Thank you for that question, Martin. Aiden Vaziri asks from the San Francisco Chronicle, he asks, Dr. Mark Galley, the state health officer, said today that California's case rate is persistently low, but has stopped declining. Are we seeing the same, seeing numbers leveling off in Sonoma County? And Dr. Mace, are you concerned that the numbers are leveling off?
Well, let me ask that of Kate. I think we are seeing still a decline, a very small but steady decline in cases, right, Kate?
So I'm sorry so the question is
Or
where are
is
case
our
rates trending?
Yeah, is it leveling off, as Dr. Galley had said is happening around California? Are we still seeing a slight decrease in case rate?
So yeah, we were actually discussing that today and looking at that modeling. And it, I think we need to look at it closer for our local rates, but the projections are showing a bit of that leveling off. And I mean, our case rates are lower, but, we would still be considered in the red tier under the old blueprint framework. So we're still not at the low case rates, that we saw back in June and or even prior. So yeah, so I think that we're going to have to watch that, but that is something we're looking into.
Yeah, and it is concerning because we are heading into the winter months, and we do have influenza also that is going to be of concern here in the next 3-4 months or so. So although, there is hope and we should be optimistic and continue with our vaccination efforts, I would just advise everybody to take precaution as well. Especially if unvaccinated, the key is to get vaccinated. And if unvaccinated or in the process of getting the second dose after the first, be careful. And for anybody who's concerned, you can and should wear your facial covering or mask if you're in settings that you're concerned about, and avoid large gatherings. I think these are the key things we can still keep up until we can get to a place where we feel like we're really back to normalcy.
Thank you for that answer. Dr. Mace, along those lines, Marcia from Community asks, when will the mask mandate be lifted? So, as we're going through the winter coming up, and I know you've touched on it before with the criteria that we need, but if you could go over that again for the benefit.
Sure. Yeah, so the earliest that the indoor mask mandate would be lifted would be late December, early January, because one of 3 criteria would have been met at that time. Will probably be 8 weeks after the full emergency use authorization for the vaccine for kids 5 to 11. That's one of 3 criteria. We also need to be still with a case rate in the yellow tier for CDC, that is under 50 new cases per week, 100,000. And we also need to have a low and stable hospitalization rate. So once those 3 criteria are met, then we would be able to move towards lifting the mask mandate for indoor situations. Of course, it doesn't mean that you can always wear a mask if you feel more safe doing so, but the mandate would be lifted at that time.
Great, I appreciate that. Martin, did you have another question? See your hands raised again.
I did. I wanted to ask something about deaths and hospitalizations again. So we're at 404 deaths, and if I'm reading the county's website or dashboard correctly, 1,982 hospitalizations. Is that right?
What was that number?
1,982 total hospitalizations. That seems like.
Kate, is that correct? Or I'm not sure. I haven't looked at that dashboard today.
Yeah, I believe so, Martin.
So that means that 20% of all the people that have been hospitalized or roughly died, with COVID-19 died?
I think that would be a better question for Cinda Gardner on our team. I can have her follow up with you if you like, but she does keep statistics on the number of hospitalizations in the ICU or resulting in death, and could provide those breakdowns for you.
It seems like an extremely high share of people. the hospitalizations that end up, with the worst outcome.
Yeah, I will have her follow up with more information. So you're mostly interested in, you'd like to know the proportion of hospitalizations resulting in death, correct?
Yeah.
Okay. Yeah, we'll get that to you.
All right. Thanks.
Great, thank you, Martin. Dr. Mace, another question about masking in schools. Maria wants to know why events where adults can attend, like bars and concerts, people are allowed to go without masks, but kids have to wear masks at recess during schools.
Yeah, thanks for that question. The indoor masking mandate, that's an indoor mandate for different settings. I mean, obviously in bars and restaurants, if you are eating and drinking, you're not able to actually wear a mask, but the mandate does state that you should wear a mask whenever not eating and drinking. In schools, the school is considered because of a congregate setting where you have a lot of people together, and we're trying to take the greatest precaution possible. And remember that, outdoors, it is a recommendation that students mask at this time in school settings.
Great, I appreciate that. Some other questions about the pediatric vaccines. When parents are taking their kids to get vaccinated, is there anything that they need to bring? They need to bring a birth certificate to prove how old they are, or what should they know?
Yeah, great question. It would be ideal if parents can bring either a birth certificate or a medical card or some kind of ID. Of course, it's harder for children to have some kind of ID compared to parents, but ideally, if they are able to, that's good, because then that helps us to get the information into the vaccine registry and ensure that it is entered correctly. That being said, if parents do not have that ID, no one will be turned away. Our goal is to vaccinate everybody as much as possible. But yes, if there's some form of ID, that would be appreciated.
Great. And what about if a lot of parents will be taking their kids probably to their pediatricians to get vaccinated as well? Can they get the COVID vaccine along with other vaccines at the same time, like a flu vaccine or other vaccines that they need?
Absolutely. And we actually do have data now. Pfizer does have data for co-administration of flu and other regular pediatric vaccines, and it has been found safe to give them at the same time. It's recommended that they be given in different sites. So one shot in one arm, one in the other arm, separate them that way, but otherwise, yes, they can be given on the same day.
Great. And this is a little more speculative, but there's, right now we're looking at 5 to 11. What about younger than 5? There's some kids younger than 5 and some parents who'd like to get those kids vaccinated. Do you have any idea about when those could be approved?
Yeah, so the studies are underway for the next age group, which is the 2 to 5-year-old age group. So we don't have the information on that yet. What I have heard is that sometime in midwinter that data would be available and would be presented to the FDA just as the data for the 5 to 11-year-olds was. So we're looking at early 2022 is what I have heard. After that, the next age group is the 6-month to 2-year. That study is also underway, and it's expected that it would be released sometime after the 2 to 5-year-old age group.
Excellent, I appreciate that. Looking to our media partners, are there any other questions from the media? Okay, if not, thank you so much. Thank you, everybody. Thank you, the panelists. And we look forward to doing a COVID update again soon. We are also planning on doing joint webinars with the Sonoma County Office of Education. So check our Facebook page for the dates and times of those. Those will be coming up real soon. Thanks again, and stay safe, everybody.